Another important component of successfully integrating this brain gut behavior therapy approach into your practice is knowing how to identify the patients that are most likely to benefit from this approach. So I'll give a quick overview here of some things to keep in mind when identifying patients to refer. So in terms of appropriate patients, typically those that can identify stress as a contributor to their symptoms and who endorse that symptom-related anxiety or those cognitive affective patterns that are contributing to their GI symptoms. Those are going to be the best candidates for this approach. There's also a subset of patients who prefer a non-pharmacological approach, especially some of our younger patients. They're just really interested in minimizing their medication use and would prefer a behavioral treatment approach if possible. So certainly for those patients, it's a great idea to refer them for this treatment. Patients do need to have some degree of openness to learning about the role of stress and the impact of emotions on the brain-gut axis. It is common. Patients may have some skepticism. Maybe they've never heard of these concepts before, or they're not quite sure about hypnotherapy or using CBT for their gut. And that's okay if they're skeptical, but there needs to be some degree of openness and willingness to learn about the concepts. And then finally, patients need to be motivated to really participate in treatment. So these brain gut behavior therapies do require some degree of a commitment. This isn't ongoing psychotherapy. These are typically short-term skills-based treatments, but patients do need to commit to treatment for a few months, and we ask them to make some changes in their behaviors and practice some of the skills we're working on. So there does need to be adequate motivation to really benefit. The patients that may not be as likely to benefit are those with more severe or untreated mental health issues that are unrelated to their GI condition. So patients with obsessive compulsive disorder or active post-traumatic stress disorder, those patients need to be referred to a mental health specialist that can address those mental health needs first. Similar for active substance misuse. And then with disordered eating, we know that this is very common in many of our patients with disorders of gut-brain interaction. And typically, I think of it in terms of, if the disordered eating is severe enough to qualify for an eating disorder, and certainly if it's resulting in malnutrition and they're having difficulty sustaining a minimally appropriate weight, then it's necessary for them to work with a dietitian and probably in a multidisciplinary setting for treatment of the eating disorder. And then we can consider a brain gut behavior therapy once those issues have been stabilized.